order. Bobby, do you mind reading about electronic meetings for us?
Sure. This meeting is being held pursuant to Executive Order 65, issued by the Governor of the State of Tennessee. If there is no objection from the members, let the minutes reflect that the Human Resource Committee members find it necessary that the meeting be held electronically to protect the health, safety, and welfare of the public due to the COVID-19 pandemic. Hearing no objections, we'll proceed accordingly. I do want to remind everybody that all votes are by roll call. Before we get going, the chairman's going to conduct a roll call. Please answer by stating your name and that you can hear the other members. If you want to remind everyone before making a comment or motion or second, please state your name prior to doing so.
Okay, I'll call roll for those that are here, or I'll just do that. Commissioner Lathers.
Lathers here.
Commissioner Story.
Commissioner Story here.
Commissioner Smith.
Commissioner Smith here.
Commissioner Bill.
Commissioner Bill here.
And are there any other commissioners that I've joined that I can't see at this time? And also, any other participants, would you let me know who's also here? I see. Anyone else?
Mike Weber
here from property management.
Mike Weber?
Yes.
Kathy Montgomery.
From property management.
Okay. And Kathy Montgomery? Okay. So are there any others that might be speaking tonight? Okay. So we have two resolutions before us, and if any of you that are on board would like to speak to these resolutions before we discuss those, I'll go with the first one that I've got here is resolution appropriating and amending the 2021 budget by $26,864.01 for costs associated with the approval of one additional registered nurse position, revenues to come from unappropriated county general fund balance.
Story.
Move for approval.
Story second.
Okay. Does someone wish to speak to this before we have questions and discussions?
Absolutely, I'm happy to. Thanks so much. I think it's been pretty apparent that we've been out doing a lot of our COVID testing out at the test site, and that we've gotten our first shipment of Moderna vaccine in today. As a matter of fact, we started our vaccinations today. We definitely want to utilize this position not only in our COVID activities that we know are probably going to take us well into the summer and potentially even the fall of this year, but also as the fastest growing county in the state, we also are seeing a big increase in the number of patients that are still continuing to come through our clinics right now. And so we need actually another nurse to help us with all of our, certainly not just COVID activities, but also our primary care and general nursing activities and processes that we do here at the health department.
Okay. Anyone else want to weigh in before any commissioner has any questions? Mike, are you okay with this? Okay. Do any commissioners have any?
Commissioner Bill has a question, if that's okay.
Sure, Robbie.
How many nurses do we have now on staff, and when was the last time we added a nurse?
Commissioner Beal, I have been in this position for nearly 8 years, and we have not issued a nurse position in this health department since I've been here. I will tell you that we actually have, wait, I have to count, I'm sorry. We actually have in this particular facility, in our Franklin facility, we have 5 RNs and we have 2 LPNs. But let me just say that those positions, okay, so 3 of those positions are actually state positions, so the county doesn't fund those. The other positions are also contract positions, so it's a cost reimbursement contract with the state. So the county pays them and they issue an invoice to the state, and then the state reimburses the county for their salaries. So really, I only have 1 RN position that is a true county position right now. And we were just able to fill that recently. But I will say this, I mean, the salaries are not, I mean, unfortunately for our nursing personnel and healthcare workers are, you know, it's still relatively low. It's hard to get a nurse into public health because a lot of our agencies and so forth do pay, and Steve can probably attest to this, that, you know, we're competing against a lot of contract and travel nurses and so forth as far as the salary dollars. It's certainly definitely more, a little more appealing when it comes to, you know, working in that field, in the healthcare field. But we are definitely shorthanded here.
I certainly understand based on COVID, and again, I don't want to draw this out. I know everybody's got things they want to do, but I appreciate the fact y'all haven't asked for a new nurse staff position at least for 8 years. Certainly, that's a significant growth period for Williamson County. Have y'all come to us and asked for one and been denied for the past few years, or is this the first nurse position you've asked for in that 8?
This is the first nurse position that we've asked for.
Thank you. That's all.
Any other questions or discussions?
This is Commissioner Lawler.
Okay, Beth.
Thanks, Mr. Chairman. I was just going to say that I want to thank Director Montgomery and her team for being so fiscally responsible and doing so even during a pandemic, but even beyond that, providing such great care. And in these stressful times with not only physical health issues, they're dealing with people who come in stressed. They get calls, a lot of mental health issues. People are just stressed out. They take it out on the persons that are there to help them. So I think I speak for all of us. We just really appreciate you and your team, and thank you for all you do. Thank you, Mr. Chairman.
Thank you, Commissioner.
And I would say amen to that. Are there any other questions or discussions? I see none, so we'll have a roll call vote. Commissioner Bill?
Yes. Commissioner Bill, yes.
Commissioner Lathers?
Commissioner Lathers, yes.
Commissioner Story?
Story, yes.
Commissioner Smith?
Commissioner Smith, yes.
And Commissioner Jones is a yes. Okay, show it to be unanimous. Okay. The next resolution we have is a resolution appropriating and amending the 2021 property management budget by $36,213.26 for costs associated with the approval of 2 additional property management positions, revenues to come from unappropriated county general fund balance.
Commissioner Smith, move to approve.
Story, second.
Okay, motion to approve. Do we have someone to speak to this?
Yes, this is Kevin Benson, the Director of Property Management. Good evening,
Okay.
Commissioners.
Good evening.
Historically, yes, good evening. Historically, our security was part-time with just 1 full-time supervisor before the COVID hit us. That was mainly, and it is mainly for the AOC. We had the big boilers we had to maintain, watch on, as well as the building itself. Since the onset of COVID, and the command and control and how we're moving people through the administrative office complex, there's a requirement to really put 4 people on full time during the daytime hours from 8:30 to 4:30 every day, Monday through Friday for the most part, when the county center's open. We did shift over 2 of our part-timers because it was an immediate requirement. And thanks to Mike Weber to assist in getting this done. But early last August, within 1 week, we were able to get 4 full-time individuals moved in those positions so that we can maintain mostly the county clerks, but then control the access to the rest of the departments in the AOC, and then increase the overall PPE and make sure we were enforcing that as well as that came out into the county. What we've come up with, however, is due to the length of the COVID, is that these 2 individuals that we had part-time have now reached so many hours that we are in a position, and Mike Weber can speak absolutely better to this than I can, but we've come into the position where we will have to pay their medical and certain benefits for them because of the number of hours they worked in the year. So right now what we're asking is to transition these 2 over to full-time individuals. We can maintain them as full-time if the COVID and when the COVID slacks down within the AOC itself and use them throughout the county. My budget can absorb them for the rest of this fiscal year until the next year starts. So even though you see the amount of money asking for it, it would not start until the next budget year. Pending any of your questions, that's kind of the roll-up.
Okay. Mike, you want to add anything to that?
Well, just as explanation, can you hear me?
Yes.
About the Affordable Care Act. As some of you know, that was passed some time ago. It's still in effect. And these employees are nearing the end of their 12-month employment with the county, where we have to look at that also. And both of these have averaged more than the 30 hours a week at this point. They got a couple more months, I think the first part of February or something, when their year ends. But they're already up to that limit. And we're going to have to provide insurance anyhow. We also, they have been averaging more than 32 hours a week. When we first went on this, none of us knew how long COVID would last. This position, and like Kathy's position also, we didn't want to ask back in July before we knew all these things and what was going to happen. But we're coming to that point now that we have to deal with these because it's lasted longer than maybe some of us were anticipating. And it's just a result of the number of hours that they've had to work. And that's 2 of them. Now, the other 2 we will look at a later date because they were brought on later in the year. But these 2 were coming up on that time where they'll be at their annual anniversary, first annual, and that's the measurement period we use. And so they will be eligible to receive any medical benefits at that time.
Do we have any questions?
Again, I'm so sorry. This is Commissioner Bill, and again, I don't mean to slow us down. I just
That's okay.
the way I understand it is we can absorb the 2 that are there at least until our fiscal year starts. The other and then try to fund, and this is to fund them beyond. Is that, am I being dense, or is that what you're basically telling us?
I would go speak to that.
Positions.
That we're asking for we're asking for the new positions, and it would be funded beyond. He can, Kevin says he has the money for the salary to cover those salaries for the remainder of this year, because he's just going to not fill those part-time positions they create. There would be no need to. So take that money and go ahead and apply it toward these salaries. But yes, we would be making it permanent or asking for it. And this is a procedure that we do normally. It's built into our policies that just the hours someone works doesn't dictate that they are full-time, but the hours and approval by The commission is what dictates it. Of course, with the Affordable Care Act, that's a different set of laws that we have to follow and deal with that. But yes, sir, the plan is to go beyond this July at this point.
I'm just wondering if, again, I understand that it sounds like a broken record. I understand because of COVID, it's put increased demands on everyone. I'm just wondering if we're being a little too premature asking for the positions at the beginning of a fiscal year. If we can cover it for this year, why not just hang back, cover it for this year, and see what happens. I'm not. And again, if I'm missing why I should be convinced this needs to be a running thing, please help me. But I'm not quite sure why we need it now.
Commissioner, am I on?
Yes, you're on, Mike.
Okay. Regardless, in February, they will be eligible for full medical benefits. We don't have a choice in that matter. They will get them. For our choice, yeah, I mean, we have to follow the law. So they've also averaged over 32 hours a week, which in our manual is full-time employment. Is considered full-time employment for all the other benefits and for us to consider somebody full-time. If it's, if that's your choice, course, that's certainly what I guess the commission and everybody can vote on and make that. But we can't not provide them medical benefits when they're due for those medical benefits, and that'll be coming up pretty soon under the Affordable Care Act. If you want to say, well, let's just do that and wait, well, then that's, something that I guess it's within your prerogative to vote in, the commission's prerogative to do, and we would adjust accordingly, but that would not impact the fact that they will be receiving the medical benefits.
Again, listen, I understand completely that we're under the law to go ahead and provide benefits because we've been working so much. And I understand completely that we've worked them so much because we're trying to enforce it COVID. I just hate to tie us down next July to 2 whole new positions if we're really doing it just as a stopgap measure. And I welcome any comment from the other commissioners to tell me why that's a stupid concern.
And Chair,
Chairman? Oh,
Yes.
go ahead, Beth.
thank you, Mr. Chairman. I was just going to say, I think that there's an interpretation between a stopgap versus a need for positions with benefits to retain quality employees into the future. And I think we've already had a brief discussion about the growth that's occurring in our county. I guess I kind of look at our directors and managers that, those of us who sat on budget committee, we know how little they ask each year. So much of our money is directed to schools as it needs to be. But I guess if I understand correctly, this is something to retain quality people to provide benefits for those people who are working so they can go forward with us into the new year. Am I understanding that correctly?
Would you say so, Mike?
I was going to let Kevin, are you there? I was going to
Yes,
let Kevin respond to that.
Yes, Commissioner Beal, I think the best way I absorbed it as Mike and I have worked through this is, we can release them. Come February, we cannot allow them to reach that maximum number of hours, that point where the law says now we have to provide benefits. So I would have to release them and then rehire some other people. I mean, that's a way to think about it by law that says these 2 particular individuals, we've got to start giving them some benefits because of the number of hours. They're averaging 42 hours a week since back in August. So that's where the compiling of all these hours, plus they were part-timers before, so they compiled a few hours before we initiated the COVID extra security measures. So that's the best way I can see how it works.
Mr. Chairman.
Is there a viable position in the future? I believe there is. I'll stop at that point.
I think Chad had a question. Chad?
Yeah, thanks, Chair. Thanks, Chair. So I think what Commissioner Bill may be asking, and if it's the way I'm thinking as well, are we having to approve this position because it's turning into full-time, or can we just fund it at the full-time rate, including do we have to approve the actual position, or can we just approve the actual expenditures for the position and not make them a long-term deal and then have it reevaluated in the new fiscal year budget? Is it an either or thing, or if it's going to be a full-time position, you have to go ahead and fund it now, and there is no waiting? Because I know, like you're saying, the law is telling you have to do it. The question is, do we have to vote on it to make it so, or can you just can we vote for the expenditure of the current budget and then vote on the potential position in the next budget?
Chairman, I have a comment, please.
Okay, Commissioner Smith.
First of all, you can have a part-time employee that works the hours that require benefits, and you can pay their benefits and still keep them as a part-time employee. The question Robbie has, I believe, is there a need for these people to be permanent full-time employees going beyond the COVID crisis, which has increased their hours? What is the need for these two people to be full-time permanent employees in the next fiscal year and the fiscal year after that? Mr. Chairman, may I real quick just respond? And you're correct. The employees can be given their variable hour employees, their medical benefits, without creating them as full-time employees in the book. That can be done. I will continue to face that, and that's one of the bigger benefit packages you have. The reason that Kevin is also looking though at the full time, because one, he doesn't know when this is going to end. Two, he can use these, according to him, on down as we continue. The security guards, when you're trying to cover 24/7, he's had difficulty in maintaining a lot of the part-time people that want to work just a few hours and those that want to work it all. And so he sees this as part of the growth. That's certainly up to the body if they wish to defer this or something, beyond for the permanent. And I hate saying permanent because HR people don't like the word permanent. Just full-time regular position like any other full-time employee. But we will have to provide the medical insurance as soon as that becomes ready. Now, I do have concerns, like I said, about our policy about, they have been working the 32 hours or averaging that a week, the way this comes out. But that's also why I put in the policy years ago, the caveat that the 32 hours is one thing and the approval by the commission as such was the second. So both of those have to be part of this in order to do that. Kevin would like to address why he sees that this is going to be an ongoing need, or if you wish to hear that, from him, that'll be fine. But yeah, we can distinguish between the two. We can provide the medical benefits without providing them at this time.
Kevin, do you want to again bring up the need after July or after the COVID for these two individuals? No.
Mr. Chairman, this is Bobby.
Yes.
What you've got before you is the funding of these positions. It's partial funding for the last 5 months, I believe, of the year. So technically, if you're going to fund it going beyond, you're still going to have to prove it in the budget come July.
Okay. Okay.
This is Commissioner Bill. I appreciate that clarification. And again, and I don't mean to speak out of turn. If Kevin says he needs this to get us through this COVID, then I'm all for that. I just don't want to be hogtied come July into refunding these positions. I want everyone to know that, quite frankly, my position is it's temporary, kind of a wait and see until we get through this. So, you know, that answers my question right there.
Okay.
Mr. Chairman, I would say that, again, we're talking about individuals that have been working, you know, it sounds to me like it's not just about a position, but it's retaining people and giving them the benefits due, so we do retain maybe some quality people in those positions. So I'm in support of this. Thank you.
Okay. Any other discussion, or do we have any other discussion on this amendment?
Mr. Chairman.
Or a resolution, excuse me, yes.
Well, I would just say, going back to my point, we can pay the benefits if that's an issue of retaining the employees without making them full-time salaried positions, which we would then have to include in the following year budget, unless Kevin is prepared to let them go at the end of the fiscal year if he can't demonstrate that he needs them going forward.
This is Commissioner Bill, but I think what Bobby just said is that all this resolution does is basically do exactly that, Steve. We pay their benefits until the new fiscal year. But I don't want to be attached to hiring these two guys on out. And again, if I'm being dense and I've misunderstood that, Bobby, please help me out. But I guess what I'm saying is I agree with Steve. I only want to fund their benefits on into the next, until we get to the next fiscal year and make a determination there. If that's all we're doing here, I'm ready to vote. If I need to offer an amendment to do that, then I'd like to offer the amendment. So, Bobby, help me out and make me look more intelligent than I am.
Actually, you're correct. I mean, the resolution is clear in its intention. It says it's funding for new 2 positions for the remaining 5 months. Okay. You can see where they've broken it down and doubled it. This is what it's going to cost that you have to fund from the last 5 months of the year. Now, it could be in the budget coming up should those positions be needed, but you're not approving that tonight. You're approving the budget to pay for these people.
Okay.
Mr. Chairman?
Yes, Diane?
Yes, sir. With all due respect, I wanted to just point out to you all that it is standard for the positions that the HR committee approves mid-year for those positions to be carried over into the next fiscal year. You are approving new positions for the department, and the funding in this resolution is just to fund them through the remainder of the fiscal year. The same as in the prior resolution with the nurse, that position will appear again in next year's budget without having to go before the HR committee to be recognized as a new position in the next fiscal year. If it is the intent of the committee to only move these, to provide benefits for these 2 part-time positions through the end of June, then that would need to be an amendment to the resolution that you are recognizing that the positions are to be readdressed in the new fiscal budget review process, similar to the way you do with grant-funded positions.
Mr. Chair, this is Commissioner Bill. I'd like to offer that amendment.
Okay. Do we have a second to that amendment? I mean, right? Yes, second to that.
Mr. Smith, second.
Okay, so we have an amendment to this resolution to fund these 2 positions through the rest of the year, and then we'll revisit at the budget time if we need to make these full-time in the coming year, fiscal year. So do we have any discussion on that amendment?
Mr. Chairman, my discussion would be, is the amendment that I seconded that Robbie offered such that these positions will continue as part-time with benefits through the end of the fiscal year?
Mike?
No,
Mr. Chairman, these positions will continue to be part-time if this resolution through the end of the year with medical benefits only. I'd like to remind these people who've been working full-time since I received no sick pay, no holiday pay, if they don't come to work, you know, they don't get paid like everybody else. So those benefits, no retirement or any of the other benefits that, you know, full-time county employees enjoy would not be part of that. So they would continue as part-time employees, and we would be paying their medical benefits throughout the year, you know, the calendar year, as long as they're part of the, you know, it'll be through next January.
And Mike, if I may, I do believe that the resolution needs to include the funding for the medical benefits, if I understood my conversation with budget director correctly.
Was the I thought funding was in there. The 10-6 plus. Yeah.
That is in the resolution, but you were indicating that they would not have security, those other benefits that are outlined in the resolution. And of course, I don't know that you need to amend those out, because if it's not spent, it rolls back into the county general fund, and we're not talking about that much money for the next 5 months. But I do know that we needed to provide the medical health insurance funding.
If I may, Mr. Chairman, virtually all those benefits listed are part of normal pay, which is FICA, Social Security. The only one would be the retirement, which goes just to full-time employees. That's 4.85% of their salary or their hourly rate, or $14 an hour. So that, you know, if need be, that can be amended out. If that's what wishes, but we just wouldn't, they wouldn't be eligible. We wouldn't, you know, allow them to take anything.
Any other discussion on the amendment? Are you guys ready to vote on the amendment then?
Mr. Chairman, I think we need to be clear on what the amendment is. I believe what the amendment is that these two positions will go back to part-time unless they can be funded otherwise. Is that correct?
I think that's correct, right, Commissioner Bill?
Yes, sir. With the understanding that we understand we have to pay their medicals because of the medical benefits because of the hours they're putting in. That's correct.
And Bobby, will we need to take the retirement out and everything right now as a part of that amendment, or can we do that at a later time?
Well, honestly, you're just recommending approval.
Okay.
So, I mean, if it's your intent not to fund it, then you can amend it and take it out. But again, this is just a recommendation
Okay.
to the Budget Committee and then on to the County Commission.
Okay. Okay, everyone, any other discussion on this? Okay, all those for the amendment, I'm going to call by roll the way, I mean, I know it's not alphabetical order, but it's the way it is on my computer. Commissioner Lathers?
There's yes.
Commissioner Bill?
Commissioner Bill, yes to the amendment.
Commissioner Story?
Commissioner Story, yes on the amendment.
Commissioner Smith?
Commissioner Smith, yes.
And Commissioner Jones is yes on the amendment also. So the amendment passes 5-0. Okay, now back to the original resolution as amended. Any other discussion on that? Seeing none, are you guys ready to vote? If so, Commissioner Lathers?
Commissioner Lott, yes.
Okay, Commissioner Bill?
Commissioner Bill, yes.
Commissioner Story?
Commissioner Story, yes.
Commissioner Smith?
Commissioner Smith, yes.
And Commissioner Jones is also a yes. So as this resolution was passed as amended by HR. Is there any other business to come before the committee tonight? If not, do I hear a motion to adjourn?
Story, motion to adjourn.
Okay, Story and second, someone?
Commissioner Smith, second.
Okay. Guys, you have a great Christmas. A meeting is adjourned, and you guys have a great Christmas, and we'll see you soon.
You all as well. Bye-bye.
Bye.
Anna.